showcasing gardens and nature in the valley and beyond. This is Let's Grow There, a WKBN Plus exclusive. Let's dig in. Hello and welcome back to Let's Grow There. I'm your host, Laurel Stone. Now, we all know about the rewards of gardening, but what about the risks? The bug bites, the splinters, the injuries. If you're outside all day, you generally come in looking a little bruised up. And I have a special guest here today to kind of help you and work our way through some of that. Everyone, say hello to Dr. Mike from Salem Family Care. Dr. Mike, I'm going to let you go ahead, introduce yourself, and just tell our audience a little bit about your experience.
Yeah, it's great to be here. I'm Dr. Mike Sevilla, and I was born and raised here in the Youngstown area in the Valley, and I've been down in Salem practicing medicine there for over 20 years now. So I'm in an office there, and I'm really excited for this topic today because I get a lot of questions, especially this time of year with the springtime and with the weather really breaking. So really excited to be here.
Well, thank you very much, and I appreciate it because we are past our last frost date now, so it is officially time to get things in the garden. And I myself have been out all weekend, and we're going to start with one of the important things that all gardeners encounter. Bugs. Bugs can be your friends, except when they're not. Starting with a quick example, one of my garden beds has a mama wolf spider living in it. She's been crawling around with her egg sack of babies on her legs. As much as I want to kill her because I don't want to be bitten, I know she's important to the garden. So talk to our audience a little bit about spider bites, like the wolf spider and some others we can see here.
Yeah, so I get a lot of questions about spider bites. And, and I love when my patients talk to me about their gardens. They're so excited about them. But, they still say, hey, what about these spiders? So what I tell my patients is that, for most garden spiders, if they do bite you, it's kind of in a defensive kind of way. Like if you're pinching them or you're bothering them, they don't actively go and get you. And just doing some research for our chat today, the worrisome spiders have really interesting names, like the yellow garden spider, the wolf spider, and the grass spider. But what my patients really ask me about are the dangerous spiders, which are very rare in northeastern Ohio. Most people have heard about the black widow, or what they call the northern black widow spider, and they tend to hide in wood piles and the underside of patio furniture and in the dark kind of corners of the sheds. And symptoms of that black widow, it's usually kind of a dull type of ache at first, followed by severe muscle cramping, sweating, and nausea. So the other type of spider, which I get a lot of questions about, and which most people have heard about, is the brown recluse spider. And they're more common in southwest Ohio, not so much in northeastern Ohio. In my research, they're also in wood piles. But when they have the bite, it is kind of a bullseye type of bite, very distinctive. People can kind of search it on the internet there, what you see. And it develops a dark, sunken center over several days. And so those are the major dangerous type of spiders that I get asked about.
So I'm going to interrupt here.
Yeah, go ahead.
When do we as gardeners, if I'm outside in the garden, I get a bite, I don't necessarily see what bites me. How do I know when to call you?
Yeah, so when I get questions about bites, when it's, kind of your run-of-the-mill type of spider bite, kind of some first aid type of things are obviously to clean the wound, use cold compresses. Don't use warm compresses because sometimes that can get the fluids in your skin more and cause more of a problem. Now, when it comes really to being concerned about something like the black widow, if you're concerned about that, that is so severe that you should maybe think about either calling 911 or going to the ER, because those symptoms can cause intense pain, muscle cramping, abdominal kind of rigidity or soreness, and that can happen very quickly. And if you are able to get to the emergency room right away, they can administer medicines, usually through an IV. Now, for the brown recluse type of spider, obviously it's still rare in northeastern Ohio, but you can just watch for that bullseye. It's more of a kind of a wait and see attitude. It's not a definite go to the ER right away. So, but in general, most people, when it comes to spiders, it's not really a big deal. The big concern is sometimes it can cause infection, and if it starts to do that, then you should call your doctor right away.
Give me some basic signs of infection in an insect bite.
Yeah, so, you start to have, some swelling in that area. You start to have some bleeding and drainage, but there's also symptoms. People can get fever. Sometimes people can get pain and discomfort. You have that kind of yellowish, like pus type drainage. Those are signs for infection and to call your doctor right away.
Now, spiders aren't the only pests that we gardeners face. There's also ants, ticks, things like that. So we have covered already. This is a bad year for ticks. Let's go into a little bit about that.
So when it comes to Lyme disease, I get a lot of questions about Lyme disease. And, most people associate, ticks and Lyme's disease by going back in the woods, in the deep woods. But not always does that happen, because the tick that's called the black-legged tick or deer tick can be found in residential backyards. And in doing some quick research, the number of cases in Ohio over the past maybe 5 or 10 years has been increasing. So why is this? Because your garden is kind of a hot zone. And what do I mean by that? In piles of leaves, ticks love the moisture, if you can imagine that. And so they can be underneath those decaying type of leaves. And also there's a kind of transition zone between your garden and also the deep woods. And that's also where you can find ticks. And also, in wood piles and stone walls, the ticks can be underneath. So the location of the garden in relation to the woods can be a big idea there. So,
is it enough of a concern that we should wear bug spray when we do this?
I would use repellent. You can use, people have heard of DEET, which is a really good repellent. Dress like a gardener. And what does that mean? Wear your long sleeves, tuck your socks into your pants. Don't give those ticks or other insects the opportunity to bite you. When you come inside after you finish your gardening day, throw your clothes into the dryer, put it on high heat for 10 minutes, because this kills any of the ticks that are in there. And then, take a shower immediately. And of course, do that tick check to make sure that there's nothing that is hanging on you. I can't tell you, every day I have come into my office, patients tell me, oh, my family member found this tick and what is it? Could it be Lyme disease? So those could be some things to, talk to your doctor about.
Are there any other types of little creepy crawlies that we should be aware of? Like ant bites, they hurt, they can annoy you, they definitely itch, but is that anything serious or does that kind of blow over?
Ants are a really interesting topic. I get questions from my patients a lot. People get ant bites. It's kind of the same type of first aid type of things. And advice, you wash the area, ice the area, and you can use, baking soda and water sometimes to neutralize some of that acid that comes from some of these bites. And a question I get a lot is, Dr. Sevilla, should I pop it? Should I pop the pustules? And the answer is no. The reason is that if you have these stings, the pustules can drain into the skin and cause an infection, which can cause fever and drainage and pain. If you have any of those, you should really talk to your doctor immediately.
What about bee stings?
Yeah, bee stings. Bee stings are a really interesting topic because, especially with kids now, a lot of kids have bad reactions to bee stings. Sometimes you need, what they call an EpiPen when people have those very severe reactions. Sometimes they need those EpiPens, in the school or, for adults, you always have one with you because it can be a very severe type reaction. I talk to patients about, sometimes they have a bee's nest or a wasp nest. So especially if people are known to have a really bad reaction to that, I would talk to your doctor maybe about having some preventative treatments like an EpiPen to prevent that really severe bee sting reaction.
For everyone else, I was stung last year. I made a mistake. I did my research after I got stung. So something had stung me. I was out in the garden. It was my arm here. I clasped my arm.
Oh boy.
So what I did was I basically gave myself a super shot of all of the venom of this bee.
Oh no.
And then later, because, I just felt something bite me. My jerk reaction was to crush it. So it was all in there. And then I was like, oh, the stinger's still in my arm. So I grabbed tweezers, pulled out the stinger. Apparently you're supposed to use like a credit card to scrape it because even tweezers to pull it out can get more venom. So tell me a little bit about extracting it and then just treatment after to soothe it because I was purple for a few days.
Yeah, so sometimes, when you do get a stinger in there, it can be very difficult to remove. And when people try to remove it, sometimes it can make the problem worse and cause a deeper type infection. So it's a really difficult call because sometimes, even when patients come in to see me, can you take out the stinger? And sometimes I mess with it a little bit. And, sometimes you can, kind of drive in that stinger even more into your arm and cause more of a problem. So it should definitely be the judgment call of your doctor to kind of see, should that something be removed? But it could be a difficult thing because obviously most people are like, well, it needs to come out, but sometimes not, or sometimes it needs to be looked at by a doctor.
How do you make that judgment call? How do you know when to call the doctor? Like, I didn't even think of calling my doctor. I was just like, oh, there's a foreign body in my body and pulled it right out. How do you know?
Yeah, so it kind of comes back to, those signs and symptoms of possible infection, redness, swelling, bleeding, fever. Now, sometimes people can get severe reactions like shortness of breath or chest pain or dizziness or lightheadedness. That kind of ramps it up more to maybe think about going to an urgent care or an ER to make sure that there's no severe type reaction that's going on.
All right. Thank you very much. Now that we've talked about our small problems a little bit, let's talk about some of the bigger ones and the aches and pains that we get just working naturally in the garden. We're going to take a quick break for the commercials, and then we'll be right back. Hello, and we are back. I'm your host, Laurel Stone, joined today by Dr. Mike, and we're talking a little bit about the risks of gardening. We just covered some of your basic bug bites, and now we're talking the bigger picture, the aches, the pains, just the way you handle yourself, because gardening can be rough on the body. Dr. Mike, I'm going to let you go ahead and take it away.
Yeah, I mean, this is I get this question a lot. I have a lot of older patients who, they're just Laurel, they're just really excited just to get out there. It's been a long winter, and they're ready to get out and plant their favorite stuff, whether they plant flowers, they plant vegetables, and just to get out there and do that. But, when I talk to them, I'm like, oh, we should really kind of just do a real, brief check of your chronic medical problems and things. So if you're out there and you're really getting out there, getting ready, you should really double check with your doctor. I have a lot of my patients, who they do have, aches and pains and bad backs and bad knees. And I give some tips, just don't go out there, do some stretching exercises, get ready. Don't do anything stupid. Do that 5-minute warm up before you go out and tackle your garden. And especially if you've had, previous issues with your back or your knees or your hip. They have this thing called gardener's knee. I don't know if you've heard of that before. So the medical term is called prepatellar bursitis. And what is that? So that is, people who kneel a lot, especially when they are doing their gardening. You can get inflammation. Inflammation causes pain. And a quick tip that can help with that is, just use a foam kneeling pad when you're out there gardening. Some of you, who are allowed to take like anti-inflammatory medicines to help with your arthritis symptoms, that's always a good thing too. Another tip that, especially on hot and humid days, make sure that you get enough hydration. I can't tell you how many people, that come in my office, they're fatigued, they're tired, and they can't figure out what's going on. And especially on hot and humid days, I ask them, hey, how much water have you consumed today? And they're like, oh, probably not enough. And, when it does get hot and humid, I get worried about, things like heat stroke or heat exhaustion. And those can be very severe medical type of issues. So definitely keep well hydrated when you're out there. Another question I get, I had a little stub of my toe or skin on something metal. My first question is always, well, when was your last tetanus shot? Oh, doc, I don't know when my last tetanus shot. Well, let me look at that. And even a minor scratch from a rusty fence or a dirty garden tool can really cause a problem. So if you're not up to date on your tetanus shot, ask your doctor about that. So, and I guess the last thing on this topic is, especially in the springtime, I get questions about allergies. People like me, I get problems with allergies in the spring and in the fall, runny nose and watery eyes and that type of thing. So what I advise my patients, a little pro tip is, if you usually take a little bit of an allergy medicine, I would take that before the pollen count goes up. That can save you a lot of headaches and heartache. So I don't. I hope that's a lot of nice basic tips there, Laurel.
Now, you talked about some of your clientele being older people have soreness in the garden. I would like to say I'm younger than some of them might be, but as someone who spends hours out in the garden, I'm stiff and I'm sore when I come in. So my garden beds are, they're a little bit above the ground, but they're still pretty low. So I am getting on my knees and like reaching over things, trying to be delicate. So what kind of positioning do you want to avoid so that you don't strain anything?
Yeah, so especially with gardening, there's a lot of what we call repetitive type of movements. You're moving your arms or you're moving your back. And especially if you're prone to have issues with your back or your knees and things, make sure you take a break, every so often, especially when it's hot and humid out there. But I have a lot of patients, I have to tell you. They're like, I have to get it done, Doc. I have to get it done. The rain's coming.
I do. I've got to get them in.
You got to get it in. And then that's the time when they overdo it. And then there's a problem. And then they come and see me. So for those repetitive type of movements, just be aware of it. Take breaks. But, especially if you're kneeling, you can use a protective pad to help with that. Or, if you have arthritis and things, you can even protect your hands, with gloves and things that can protect against those puncture wounds, needing a tetanus shot. Some simple things will go a long way.
Let's talk about end of the day recovery. If my knees are sore, should I, once I'm done in my garden, do I lay on the couch? Do I elevate? Do I ice pack? What are some things to do after the fact?
Yeah, so after you end your day, if you haven't been hydrating already, go ahead and hydrate. Get those muscles, get that lactic acid out of those muscles, and do that. And if you're prone to have things like knee problems or back problems, I would not use heat. I would not use ice. I would use heat on those areas. You can use a heating pad. You can even use like the athletes use. Like those creams or, Aspercream or Icy Hot or those patches and things to help keep those muscles from tightening up.
So is that why you avoid ice? Does ice lead to tightening up, which makes it worse? Because normally you're like, oh, it's sore, you slap some ice on it.
Yeah, so with ice, it's if you have an injury that happens. So if you have that, if you pull your back or you have that knee sprain, to prevent swelling, then initially ice is the thing to do. But if you're having what we call overuse injuries, or those repetitive movements, I advise my patients to use more of a heating pad. It doesn't have to be scorching hot, but just keep that, and then try to stretch those muscles out at the end of your day. Just don't overdo it, because you may pay for it, and then that'll put you further behind in your gardening.
That's a very good point, and good advice that I think all of us gardeners need to take to heart. So thank you for that. We're going to take another quick break, and then we're going to come back with some more common ailments that gardeners face. We'll see you then. Hello, and we are back. I'm Laurel Stone, joined by Dr. Mike. We've talked a little bit about bug bites, how not to strain your body. Now we're going to talk about something else the gardeners face, rashes. If you spent a day outside in the garden, pulling weeds in your yard, messing around with who knows what, chances are you're going to come inside, have some little red speckles like I do, probably some itches here and there. So Dr. Mike, talk to our audience a little bit about some of the common ailments that people face in this.
I've always, I've almost, in fact, I've already had patients come in with their poison ivy and poison oak. And as most people know, that kind of has a special type of oil that can get all over your body, which is not really fun. It's intense type of redness, followed by small little fluid-filled blisters that happen. And it kind of goes in a line, or what we call linear type of patterns, because that's where the oil just kind of goes down the arm. The second type of rash, in doing my research, is that there's some plants that have a sap, and then that gets in your skin, and then sun gets onto it, and then that causes the rash. This appears within the first 24 hours. It can feel like and look like a very severe type of sunburn, but it's actually kind of a chemical type reaction, which is definitely not fun. And the other type of rash that I get questions on are these prickly rashes, and I had to do research on this, is the stinging nettles. Are you familiar with the stinging nettles?
I am. I have not encountered one myself, just because I know of their existence. It's really funny because when you boil them, they have really great medicinal uses. But if you just grab them with your hands, it's ugly.
And right away, when you touch it, you have small white or red raised bumps or hives, and it gives a stinging type sensation. And I get questions, well, Dr. Mike, I think I touched something or something like that. What should I do? The first thing is to kind of degrease yourself immediately. Now, regular soap, as most people know, but you may not know, regular soap can sometimes spread out that poison ivy oil. So use something like Dawn dish soap that can kind of break through that and prevent that. And use cold water only. The reason is hot water opens up your pores and can let the toxins go in deeper, and that's going to be more of a problem.
That makes sense. You'd think hot water is drying, so I feel like I've probably definitely done that wrong, but the logic makes sense there.
Exactly, yeah. And what most people don't do, because they have a busy day, is that they don't have time to clean their tools. They've done some studies, and that some of that poison ivy oil can be on those tools for weeks, months, even longer if you don't clean them. So it's very important to do that. And the last thing I want to mention in this section is your pets and your dog. Now, your dog can go through this same type of patch or the same type of poison ivy that you went through. Remember, if you think that you saw your dog went through there, you got to clean off your dog, because you don't want to bring it inside. You want to bring it to other people. So don't forget to wash the dog. Now, when should you call me? So when you should call your doctor, are if you start to have these severe type rashes on places like your face or your eyes or your genitals. Those obviously are not fun, but they can, especially in the face and the eyes, that can be a problem medically.
One more thing that you had in your notes for us to talk about today is sunburn. I think as
Hmm.
gardeners are aware about it, but just talk a little bit about the importance of making sure our skin is safe.
Yeah, so kind of going on with skin, is prevention. Especially people when they get out there in their garden, they can sometimes forget to put that sunscreen on, and there could be a lot of people who are prone to sunburn, and sunburn year after year after year can sometimes lead to skin cancer. So that's something that I really advise my patients about. And for those gardeners out there, dress dress like a gardener. Keep your skin covered as much as you can. But when patients or people, start to get moles or different types of rashes and things, those are things that should definitely be checked out by your doctor. We always worry about early skin cancer. Sometimes people have a family history of skin cancer that could be genetic. So when you're out there in your garden, make sure you put the sunscreen on, reapply it, and if there's any kind of questions about any types of unusual rashes, get that checked out by your doctor immediately.
Thank you very much, Dr. Mike. I appreciate it, and I appreciate you joining us here today.
It's great to be here. Thank you so much. Happy
Yes.
gardening.
For our gardeners who've watched, hopefully we've saved you some pains in the future. We'll catch you next time on Let's Grow There.